Hi, my name is Dr. John DeRazio, and I'm a pediatric oncologist who takes care of children, adolescents, and young adults with cancer. And I'm also a physician scientist and cancer researcher at the Markey Cancer Center at the University of Kentucky. So I come from very humble beginnings. When I was a kid, we moved down to Palm Beach County, Florida, and my parents started a bait and tackle shop. I credit my parents and thank them for believing in the value of an education and in the American dream, and for pushing us to do more. As an undergraduate, I took a course in biochemistry from a professor who turned out to be one of the formative people in my life. She was a bit of an odd lady, you know. She wore clunky shoes and corduroy pants, and she would always swish when she walked. But she was such an exciting and illuminating teacher for me. It was the first time I'd ever heard about DNA replicating and reproducing, and about proteins and amino acids, and everything fit together and made sense. She was collaborating with a chemist who was making platinum drug derivatives to try and find some that would treat cancer. She would test these drugs on colon cancer cells in her lab, and I volunteered to be an undergraduate researcher with her. I decided because of this experience that I really loved science and that there were important discoveries to be made in the world of cancer. I'll tell you a story from my first year of fellowship. This involves a young man who was one of my favorite patients ever. He was a 13-year-old young man who developed bad leukemia called Philadelphia positive leukemia. This leukemia is particularly difficult to treat, and about only 20% of young people at the time with this kind of cancer survived. Philadelphia positive leukemia is famous for not responding to the treatment, and sure enough, it took us 3 or 4 rounds of different chemo just to get him into remission. He then went through a bone marrow transplant, his best chance of cure in the year 2000, and he did very well for a few months. He then came in one day in the fall for routine follow-up, feeling just fine. But his white count was something like 300,000, which meant his leukemia was back and back with a vengeance. He and his family and me were all completely devastated. He had been treated with all the regular leukemia drugs, and we had nothing left, or so we thought. But at the time, there was this new drug called Gleevec. A physician scientist named Brian Drucker at Oregon Health Sciences University had developed this drug based on knowledge of the Philadelphia mutation and how the leukemia happens, to try and take the teeth out of Philadelphia positive leukemia. I think my young patient was the first child in the world to even get this drug. The company let us have some on a compassionate use basis. We started him on it on a Friday, and 1 week later his count was back down to normal at 4,000. It was an absolute miracle. None of us had ever seen anything like it before. Of course, it didn't last, because when you treat cancer with just one drug, it seems to develop resistance, and my patient's cancer was back in 3 months, and then he succumbed to his disease. It was a particularly low moment for me because I desperately wanted to save his life. 3 days before my young patient died, his mom called me up and invited me to the house, not as a doctor, but as part of the family. I sat with him, and he never gave up hope. And that is a lesson I keep to this day, is to not disengage from your patients no matter what. I learned 2 things from him that have kept with me 20 years later. One, the power of scientific research, and that research can make new insights and that they can be effective for patients. For example, a few months ago, I was on service and I got a young adult with Philadelphia positive leukemia. Now we know how to combine Gleevec and other drugs like it with leukemia drugs, and she is in remission. And she is likely to have a very different outcome because we now know how to use these kind of drugs based on years of scientific insights through research and clinical studies. So that's one thing I learned from him. The other thing I learned is that in cases where a patient is not going to make it, it matters that you, as the main doctor who's been with them from the beginning, stay involved and engaged. You know the family better than anyone else in the healthcare team, and it's not fair to them to just let them go. So you can hear from this story that I've come to believe that research and practicing medicine go hand in hand, which is why I do what I do as a physician scientist. Here at UK, we have developed a clinic to take care of children and adolescents and young adults who have cancer and have a lot of cancer in their families and have a genetic reason why they may have gotten cancer. Most insurance companies will only cover the cost of checking for very specific mutations in genes linked to specific kinds of cancer that have already occurred in the family. So for example, a patient might get tested for a BRCA1 mutation if the patient's mother had it. But because we have generous funding from philanthropic partners such as UK's Dance Blue organization, we opened a clinical study for our families who want to check for more broadly all sorts of different inherited cancer risks. And we are finding unexpected and important mutations. We can now track children and their family members and provide them counseling and testing. We can argue for insurance companies to cover needed surveillance tests to catch cancers early, and this matters throughout their lives. They also can be provided psychosocial support that we offer through our clinic. And this kind of surveillance makes a big difference in their overall survival. This is also a research opportunity because then we can study how mutations can be linked to specific kinds of cancer. So that's my long and wandering story. Of course, it isn't over yet. The work I do, it's a calling. I know it might sound strange, but it really feels spiritual to me, and I am grateful that I found this path.